Hi, it's Jan. I'm stomal therapy nurse from Omnigon. I just want to take a minute or two to talk about how you manage hair growth around your stoma. This might be a lot more relevant for men, and I do find that there are a lot of abdomens out there with a lot of hair growth, and the trouble with having a lot of hair growing around your stoma is that it can affect the adherence of your product to the skin if there's a lot of hair there, but it also can make removal of the products a lot more challenging, a lot more painful even if you're having to pull at hair to get your products off the skin. So it is important to keep the hair growth to a minimum around your stoma. A lot of patients that a lot of ostomates that I've helped over the years find that the hair growth does start to slow down after a while. Once you are using ostomy bags for a prolonged period, then often that adhesion and removal starts to minimize the hair growth. But if you're finding that the hair is growing back, it is important to address that. Some people are a little bit frightened to think about shaving or how they manage the hair growth around their stoma. So this is just a couple of ideas for those patients that might be needing to clip or shave. So some people will buy some clippers and certainly feel a little bit safer using clippers, but still worry that sharp edges may touch their stoma. The stoma, as you know, is very vascular. It will bleed easily if it's traumatized. So you should avoid touching the stoma, of course, with any sharp implements. So sometimes one of these pieces of cardboard roll from the inside of your Glad wrap or toilet roll come in handy for this purpose. So often you can cover over your stoma with a piece of cardboard and then use your clippers or your razor around the area, then knowing that while the cardboard roll is there, then you don't have to worry about accidentally touching the sides of your stoma while you shave. Now, if you are using a little bit of soap, we discussed in previous videos that soaps and such shouldn't be used on the skin around your stoma, but to do an effective shave, sometimes you may need a little bit of soap. Then once you've finished shaving and clipping, make sure that the area is well washed with lots of warm water to remove any soapy residue that you might have put to the skin when you were doing that shave. So that's about how you manage hair. And as I said, most people find that over time that hair growth does start to slow and it's not as much of a problem. So thank you.